Introduction to Block B5, Professional Behavior. We'll discuss the behavior of medical students. In this part, we will discuss three topics: the definition, the area of professional behavior, and how the applications in teachings. We know that teaching and assessing behavior is very difficult. By definitions, the professional behavior is observable behavior in which the standards and values of professional practice are applied. And usually, the professional behavior is evidenced by words, behavior, or appearance. And as we are working as a medical doctor, so professional behavior is very essential in establishing a basis of trust between patients and us, the medical doctor. So why should medical students learn about professional behavior? Well, because medical students have certain privileges and also responsibilities different from those of other students. And because of this, different standards of professional behavior are expected from medical students or the future doctors. And medical schools are responsible for ensuring that medical students have opportunities to learn and practice the standards expected of them. And so, how is the professional behavior is introduced in these institutions? So, you will learn professional behavior in a supervised environment that is safe for the patients. And also, you can identify the types of behavior that are not safe. So you will be aware and you can avoid that kind of behavior. And we can also take appropriate action to help students improve their behavior, or if this is not possible or is unsuccessful, to ensure they do not graduate as doctors. So, we have areas of professional behavior. We have 7 that we know. The first is good clinical care. The second is maintaining good medical practice. Number 3, teaching and training, appraising and assessing. Number 4, relationship with patients. 5, working with colleagues. 6, probity. And number 7 is health. We will discuss one by one about these 7 areas. The first is about the good clinical care. Well, for good clinical care, we cannot exceed our limitation. And we need to know when we have to ask for help. Yeah. So make sure that if you are doing something, you are supervised appropriately for any clinical task that you perform. And what we mean by good clinical care is there is no discriminations. We have to behave with courtesy to everyone, not only to the patients, but also to colleagues and also to the other health provider in our team. And we need to be aware that they must acquire knowledge, skills, and professional attitudes in order to professionally register with the Medical Practice Council. Number 2 is maintaining good medical practice. So we need to be aware of the responsibility to maintain our knowledge and skills. So we have to have a behavior of long life learner. So you have to be ready with that. And attend compulsory teaching sessions or make other arrangements with the medical schools. So that is the duty of medical students. And you have to complete and submit coursework on time. You have to be responsible for your own learning and make sure that you can be contacted and always respond to the messages. Yeah. And you also need to reflect on feedback about your own performance and achievement. And also, you can respond constructively to any kind of feedback from your teacher or from your friends. So what is number 3? Number 3 is about teaching and training, appraising, and also assessing. So you need to demonstrate basic teaching skills. You also have to be aware about the principle of education in medicine, which is not similar with other areas, because we involve patients and also communities. And also be willing to contribute to the education of others, like for your peers, for your friends, or for your junior. And along to your profession, you also have the duty to educate your team, as if you work with nurses or midwives, you have obligations to also contribute for their educations. And the other thing is you need to be able to give constructive feedback on the quality of teaching experience. And what is number 4? Number 4 is relationships with patients. You have to respect patients and treat them with dignity. And this needs to be exercised along the years of your education. And make sure that patients have consented to a student's being involved in their care. And this is already being arranged if you are working in a teaching hospital. So we need to get an informed consent from the patients, that you are involved in their treatment. And make sure that they are clearly identified as students. So you cannot like hiding yourself that I'm a doctor, I'm already a doctor, but in fact you are still a medical student. So you have to declare, and you need a supervision for that. And the other thing, when you relate with patient, you have to dress in appropriate and professional way, and beware that patient will respond to your appearance, So it is different when you see a medical student who is very tidy and with untidy. The patient will have different perceptions about that. So it's very important to maintain appropriate appearance, presentations, and also hygiene. Doctors have to be clean. What is number 5? 5 is working with colleagues. So here you need to demonstrate skills that allow you to deal with uncertainty and any change in the workplace. And you need to be able to work effectively in a team and to take on different roles as appropriate, of course, including taking responsibility for tasks. So you will be arranged in groups during your education years. In the preclinical or in the clinical rotations, you are going to work in groups. So it's very important to exercise respecting the colleagues since the beginning of your educations. And the other thing is you have to develop and demonstrate teamwork and leadership skills. So during the tutorials, you will be in turn act as a leader and act as members. So here you will exercise your leadership skills. The other thing is respect the skills and contributions of colleagues and other professionals and not unfairly discriminate against them. Okay, so now we will discuss about the probity, number 6. Probity means being honest and trustworthy and acting with integrity. These 3 things is very important as medical doctors. Being honest, genuine, and original in your academic work. including when conducting research. And you need to take effective action if you have concern about honesty of others. So for example, if your friends not being honest, so you need to acknowledge that, for example, and give the information to your friends. Or perhaps if you cannot ask your friends for making them honest, then you can ask the other senior to reprimand him. And the other thing is be honest and trustworthy when writing reports and logbooks. So not only looking at your friends, copying them and give it to the lecturers. Or when completing and signing forms. This is very important. So you cannot cheating for signing the forms. Not plagiarism. Not plagiarism others' work or use their own work repeatedly in a way that could miss. You only copy and paste and present it or submit it to the lecturers. And cooperate with any formal inquiry by medical school or other organizations. You have to comply with the law and comply with the regulations of the medical schools, hospital, or other organization that you will be involved in. And the last area is about health. This is the area that sometimes people think that it is not important, but actually doctors cannot cure others if they are not healthy. So beware that your own health problems may put patients and colleagues at risk. So seek medical or occupational health advice if you have a concern about your own health. Protect patients, colleagues, and also yourself by being immunization against common serious communicable diseases if vaccines are available. You will be applied for some vaccinations before you have the clinical rotations. And also be aware that medical graduates must let it be known if their health poses a risk to patients or the public. For example, you have hepatitis and there is a chance to be transferred to other people, then you have to declare and seek for treatment. So that is the 7 areas. We now will see how is the program, the professional program will consist of. So you will have many activities. Here, the broad integrations of medical ethics and health law through the curricula. You will have symposium, guest lectures, programs, and also integrating ethics and patient care, case study methods, audiovisual reviews, grand rounds, and other learnings, which is all incorporated in the clinical rotations. You will also learn from your role model. This role model is difficult to define, but when you already in the context, then you will find what kind of role model that you are looking for. And so the next, how it will be assessed. There are actually 6 items that will be incorporated in assessing professional behavior. First is the longitudinal assessment. Second, the comprehensive assessment. Third is recorded in a central file. And then fourth, it will be regularly reviewed by the academic supervisor. And the fifth, students regularly meet the supervisor. And number 6 will be professional behavior counseling committee. Well, this process will be done throughout the years of your schooling. And there are some consequences that you will have to note it and understand that if your professional behavior assessment not satisfied, then your study will be delayed or perhaps can be dropped out from medical schools. Because as we know that medical schools are responsible for ensuring that medical students have opportunities to learn and also practice the standards expected of them. So this is how we learn about professional behavior. See you in the next chapter.